All right, we're live on the scene in Vegas at the health conference. I'm with Paulo Machado. Thanks for joining me for the first interview in Vegas. So we're going to try to keep the ambience and surrounding noise to a dull roar, but it is Vegas, so we'll try to do the best we can. So Paulo, why don't you go ahead and introduce yourself and talk about your role at Health Innovation Partners.
Sure. Thanks for having me, Brian, in this lovely venue here at the MGM Grand and the kickoff of HLTH, which literally just started this morning. So very exciting to get back into the groove here. I've been involved in healthcare for over 20 years now. I've worked across the healthcare continuum, working with different organizations who are in the process of bringing new emerging technology and analytics into the marketplace to improve health and well-being. I've had been a pleasure working with such an interesting range of people who have very different needs and interests in terms of what they're trying to solve for. And it's been really wonderful to work with lots of different solution types. Since I've been doing this for such a long time, some of the languages used now to try to solve these problems is very different now with new and emerging technologies that are coming. So about 10 years ago, I started up a company that was really focused on spending the majority of my effort on what I'll call startup initiatives, whether they be startups inside large organizations, but mostly smaller organizations. And what are they doing in the marketplace to bring new concepts to the marketplace that are going to make a difference on health and well-being.
And to pause there, when you say smaller companies, entrepreneurial efforts have always been involved in healthcare. And I think only recently have we seen the influx of tech startups to come in, probably, recently being 10, 15 years. So how has that dynamic changed? The type of startups has evolved quite a bit over time recently.
Yeah, it's been interesting to watch because clearly there were always technology being used in healthcare, right? It's a huge technology-focused industry. The technology was deployed very differently, less focused on operationally and impact on running the business, so to speak, more around clinical innovation. So clearly with all the changes in policy that came out of the government over a decade ago, huge impetus to actually be able to begin to measure what it is that actually happens in healthcare. And that was basically the opening of the floodgates.
Yep.
And there was a massive deluge and interest. So now we can actually measure what's happening in healthcare. And it's come along in different waves. But if you think about it, life sciences has been using technology for a long time because that's how their business models were set up. Later on, when high tech came out and ACA, you saw health insurance companies and health systems begin to digitize healthcare delivery in a much more systematized way. They hadn't had the sense of urgency that was happening in other sectors in the past because there was less pressure on the bottom line because it's a very price insensitive marketplace. Mm-hmm. So you saw a lot of, in the beginning, it was very healthcare tech specific companies that came in and started focusing on very specific health tech problems. But now, as you can see, the ecosystem's changed dramatically in the last handful of years. You see the big tech giants coming in and everyone has a health division. The venture side, the actual capital is being invested, is coming from everywhere too. Just met a gentleman a few minutes ago who works for a very large Chinese car company who has a healthcare venture fund that they've just set up. So it's coming in from all over the place.
Yeah, the mix of people here at is it health or HLTH?
I think it's health.
Okay.
I just don't say health. When I first saw it last year, I just, HLTH, but
okay,
it's probably health.
Okay. Well, one or the other. Yeah, that's been one of the best parts so far. And we're only a couple hours in, but just seeing the types of people that are at this conference is so unique in that it's like you mentioned across the board. And I imagine that's probably one of the best parts about your job is the purview of your job covers everything, right?
Yeah, it totally perfectly aligned with how my brain works. I'm much more of a systems thinker, and Jonathan's done a wonderful job. In the first year he did it, it was already obvious that he was thinking at the systems level. He was bringing all of the stakeholders together and having meaningful conversations around what's happening now and where do we need to go. And don't know what's on store for this year, but if what their website says and their agenda looks like, it looks very similar.
Yep.
It's going to be another great year and great lineup. It's always wonderful to meet someone who you wouldn't have even thought to talk to, who has a really, really burning passion to truly make a difference on health and well-being.
Yep, absolutely. So the main question I wanted to bounce off you is, what is it like as a healthcare entrepreneur? Like, go behind the scenes, and
Sure.
I imagine in at least in theoretical world, it seems like healthcare is so much different than maybe some of the other industries. Can you tease out some of the differences?
Sure. So clearly healthcare is a bit different because for a bunch of different reasons. One, from a regulatory perspective, we're talking about people's health and well-being. So clearly you can't treat it like making couches or something. You really have to think about it more holistically and what's the impact on health and well-being. The stakeholders in it are also different. They typically take a Hippocratic oath to do no harm. So clearly that's an issue. It's an incredibly price-insensitive marketplace. Historically, that's changing a bit now that we've cost the $3+ trillion worth of cost in the system. That's obviously a big impetus for why healthcare is in the process of transforming. The costs are just becoming so large, it's squeezing out other places we should be investing our capital. So there's some massive differences that are very fundamental in terms of the basic nature of what it is. The stakeholders are completely misaligned in terms of how they're being incented in the system, right? So healthy people don't generate a lot of revenue for a healthcare system.
And would you say, is that the biggest evolution that's underway if you're looking 20 years out, going from a much more from a reactive healthcare environment where you're treating and responding reactively to a more proactive where you can use data and a whole lot of other tools and techniques to surface it before bad things happen to humans?
Yeah, it's a great question, but I think the biggest transformation needs to occur is a cultural one. The tech are just tools and enablers. There's a tremendous amount of inertia in the way healthcare was designed initially, which is a for-profit industry, when health and well-being just happens to be a side effect of generating capital at a hospital or an insurance company, right? End of the day. So it's been really challenging to shift that culture. And until that culture shifts, we're going to continue to see a lot more of what's been happening in the past. I'm a very pragmatic optimist. There's tremendously different environment now than there was 5-10 years ago. There's a huge number of efforts at every level, whether it be government, providers of care, payers of care, employers, you name it. Every component of the ecosystem sees that this is not sustainable, and there's lots of efforts underway to get everybody to work together. But you need to create a culture where it's less around competition and more around co-opetition. How do people cooperate? Basically, to really drive health at a local level. Like if you think about the health of a community, many of the more developed countries who look at health as something that they own, so to speak, that is owned by the government, right? By the society at large. It's not you compete versus this other organization. They take a look at health more holistically, and they basically create a culture that's focused on health and well-being. Not just, okay, you're a cog in the healthcare system machine that can generate $70,000 for some event that you came in for.
Mm-hmm. And do you find that established companies are rethinking their approach just as much as startups and trying to not be just a piece of the puzzle, but take on a much broader purview?
Absolutely. I think the vast majority of existing stakeholders see the writing on the wall. They're watching massive disruption that's been going underway for 10 years from every angle with the startups, but also more importantly, they're also seeing it from very large organizations who, if they decide to get it right, if they are able to get it right, they can scale quickly and displace them. There's less pressure from a hospital thinking, oh, I'm not worried too much about a small startup with $5 million in the bank. They're going to disrupt me. But it's going to be very different if they look at somebody like a Walmart, an Amazon, big existing stakeholders who are trying to tackle some of the problems and may truly disrupt them in a meaningful fashion.
And the fact that they've tackled other industries and really had shook them
had
up.
An impact.
Yes, to say the least.
For sure.
So let's go early on. If some of the entrepreneurs that you interact with, it all starts with an idea. A good idea isn't just a good idea found in healthcare. You really need to understand the broader perspective and how that idea fits in. Is that always the starting point after the idea and just kind of the generation of a possible business to try to figure out how you fit in the broader picture? Yeah,
it's a good question. So there are a tremendous number of good / great, awesome ideas. Over the years, you're seeing you see the repetition of ideas over and over again. So what I find becomes a bigger challenge than actually coming up with great ideas because frankly, they're very common. Having good ideas, it's not hard to find good ideas.
I've had a ton of $1 million ideas at 2 a.m. at a bar.
Right. Likewise. The challenge is, how do you get it from idea? How do you create a business model that's scalable and sustainable for that great idea, right? Because that's really where the rubber hits the road. And healthcare has this tremendous inertia to keep things as they are, because they don't need to move quickly. There's not as much pressure on their revenue line or their bottom line. So it's really difficult, and the hurdles and the adoption rates and the resistance to change and the risk profiles of the adopters of change are all huge hurdles. And when I say hurdles, it's not just external innovation I'm talking about, even internally, right? So a lot of these organizations also have innovation centers, which is great, but they'll tell you themselves it takes a year or two for even their own ideas to get scaled internally before they can even start scaling internally. If you look at things like EHRs, that was a big idea, right? Started over a decade ago. And now we're just starting to reap the benefits of those EHRs being in place. And people are still struggling with just the fact that they're in place, as one example.
Do you find do you almost have to take the long view with some sort of startup or disruptor from a healthcare perspective? Because I imagine there's not any obvious just jump in and completely disrupt, maybe that closer to that Silicon Valley model where you can get in and totally disrupt things. There's not a whole lot of opportunities for that, I'd imagine.
From my perspective, no, because the majority of health and well-being is not something that's a normal good. So if you're thinking about normal disruption, if I want a pizza to be delivered to my house, somebody wants to build an app, that pizza delivery app or food delivery app is going to sell to me as a consumer. There's a cost of acquisition. It's very clear, the lifetime value of a customer. They can do all that very directly, and it's a very simple business model, so to speak. With healthcare, that's not the case, because the consumer of the good, the payer of the good, and provider of the service or good, and there are other stakeholder types too in the middle there in terms of distribution, things of that sort, are not the same people. So who am I selling to when I come up with an innovation? So what I work a lot with entrepreneurs, especially the external types, right, is helping them think through not just the product side of things and how to design and develop awesome products, but how do you develop alongside the right business model? So we put the same amount of effort, very similar amount of effort into the business model development and design side as you would, because you really don't know, because there are so many overlapping, and frankly, it's getting even more overlapping now, because now you're seeing providers becoming payers doing providing. Everybody's trying to become a provider. Everybody's trying to take on some risk, right? So it's even getting more amorphous. So if you're the poor entrepreneur who's coming in from the valley, who doesn't know anything about healthcare, it all looks simple from the outside, right? I just need to get a consumer to become more physically fit, and here's an app that's going to help them do that. But consumers don't want to pay for this stuff because it's healthcare. Whereas pizza, they expect to pay for a pizza. So they're not expecting somebody to pay for their pizza, but they are expecting somebody to pay for their health app, right? So that's a huge barrier, just getting the consumer to adopt. But then typically you've got a whole series of providers who need to be involved too, in whatever that solution is. You've got to have a provider recommend to a patient, hey, you know what? I'm going to help you manage your diabetes. There's a whole series of apps I've been looking at, but I really think given where you are, I want to prescribe this specific app for you to use. So I've got to basically change the provider's workflow. Not just a clinician, but it could be a whole series of different provider types that are involved in changing their workflow. And that's not a small task to undertake. And then you have to get somebody to actually to pay for it.
Yep.
And that's another huge challenge, because there's a lot of these solutions that are being built for the healthcare marketplace. This is not medicine, or this is not an implantable device where they've done dozens of years of studies on safety and efficacy. These are just companies that are building solutions and convincing one-off B2B customers, whether they be payers or providers, to just take the risk of buying this before the FDA, so to speak, has approved it and said, yeah, this works. You should use it now. So it's a very different mindset and model, and there just hasn't been there hasn't been the need for rapid adoption. And so entrepreneurs have to be thinking about these business models and figuring out, okay, so who's going to have the most interest in adopting this sooner rather than later? Is it the employer, the payer, the provider, and test business models just like you test a product at the consumer level?
Do you find you need both the product vision as well as the business model development? Those have to go hand in hand before you can truly move forward with a viable business?
I see most failure occur because they just missed the business model. The tech side of developing the product and testing with the end user, pretty straightforward.
And
it's
that's
like,
probably the fun part, right?
yeah, that's the easy part, relatively speaking,
Easy.
because it's technology, right? You can just have somebody code it, and you can go out and do great user experience design work. I mean, it's not simple. Don't get me wrong. It takes work to get it right, but then it's all everything else. Who's going to pay for that product? Who's going to drive adoption of that? How do you drive adoption of that product? Because a lot of these things aren't a decision that a consumer makes, or even a physician can make. Because if I'm a physician in a large health system, I can't just go off and pick any app I want and do typically, because it has to somehow be integrated into my EHR, into my workflow. So you can't really go off the ranch. So it's this whole process that has to occur at the larger level. And I find most entrepreneurs really just don't, for those who don't come from healthcare, of course, they don't understand the complexities of the B2B side and the inertia there, and they don't plan for that accordingly. They plan for the cycle times on the product development side, but the business model they don't. And I can tell you from having been done this for over 10 years, in the beginning, it was really bad. People had no clue. I think it's becoming clear that the business models matter, and the same thing with the investors. So in the beginning, investors were just like, oh, we should just, this is like Silicon Valley, right? You can just like build a product in a garage with 2 guys and $100,000, and you should have like $1 million. You have like 10 cents customer acquisition cost, and lifetime value should be like 100x, and ROI should be, 20x valuations, and we should be a unicorn in no time. And all that money just went down the toilet because those cycle times are not the same, because the business model adoption is a challenge.
So let's talk about the people that choose to be entrepreneurs or make an attempt to be entrepreneurs. You mentioned coming from the tech side of things. I've seen a lot of people come from the healthcare side of things as well. Are those the two most common, the healthcare background and the tech background that you're seeing?
Yeah. So over time, for sure, most people who come into healthcare, tech, digital health, whatever term you want to think of it as, have some healthcare background. It's still a minority. You're seeing more people coming into it from outside with no health experience. I think there's a bit of frustration for people who come in from outside of healthcare who aren't truly committed to it. They just burn out and say, this is just too hard. I'm out. I've seen many people I've worked with over the last decade who just say, I'm going to go do something in consumer products or food or whatever. It's just much simpler and more fun, so to speak. So you really need people who are committed and see that healthcare is important in its own right. So it's not just the success of building a company, it's success of doing well by human health and well-being. So I think that's a big difference in the marketplace. Yeah.
Do you find most folks have a personal story attached to their?
Yeah. I don't know if I'd say most, but there are a lot. That's a great question. I don't know about most, but there are quite a few people. Probably most, when I think about it. Most people have a personal health story of some sort, and they're committed to making a difference about it. It also makes a big difference when you're trying to bring talent into the organization, right? Because at the end of the day, it's so awesome to be able to have people who are like, don't do this just for the money. They're in it because they saw this happen to a family member, right? And they're saying, wow, this is amazing. I can get a chance to actually make a difference in my own family's life or in somebody else's family's life. And there's a tremendous amount of empathy that doesn't exist in a normal job. And it's exciting to bring people from outside who can do that. We just have to get them over the hump, all that external talent, to just get them over the hump of the reality of the risk aversion and the challenges that are not just tech challenges.
Sure.
Operational challenges.
Yeah, I've definitely felt that in my personal experience coming into healthcare 6 years ago. I was doing consulting before, and then you realize the light at the end of the tunnel is a different. It takes on a different light when you realize your friends and family and whoever could interact with this in the future.
Make an actual difference.
Yeah, absolutely.
Great.
So you talk as someone who's backing these companies or looking to potentially back these companies. Are they looking through the same lens that you talked about before, the product, the business, just kind of the business process, business development side of things? Is there any other considerations they're making that maybe differ from the entrepreneurs?
Yeah, so they actually need a financial ROI because they have LPs. And keep in mind, when you say investors, there's a wide range of investor types. You've got angels, structured capital at the VC level. You have corporate venture capital. Corporate venture capital obviously also has hey, we're a hospital fund or an insurance fund, so we have to make sure that our product supports our core business model, on top of the fact that they would like to have a nice ROI on the actual solution itself. So it really just depends on who's writing the check. It's pretty obvious that there's a difference in the marketplace. Historically, there was a tremendous amount of what I'll call savvy healthcare investors. So if a hospital system has a health fund, they're all people in healthcare, basically. So they understand their own business model and they know what the problems are and the challenges. So there's not a lot of concern around lack of alignment with what the technology is and what the challenges are. As the market's gotten frothy with all of the
good word,
everybody's trying to get into it
before
they missed the boat. You're seeing a lot more capital coming into this from people who just don't want to miss the opportunity to invest in what looks like a huge bubble. Now, will it pop? Not so sure, because healthcare, again, very different. And don't forget, it's a $3 trillion+ marketplace just in the U.S. So it's going to take a lot of investment, right, before it becomes a bubble that pops. And there's still a tremendous amount of opportunity, just scratching the surface on the changes. But from the ones who are coming into for the financial return, there is a lot of what I would call healthcare naivete around what we talked about earlier.
Okay,
just
so it's
not aware about the business models, not really focused on health and well-being. Just more like, okay, I've got $1 million I want to throw into this fund. I expect this fund to deliver X ROI because I threw $1 million into a different fund, and this is what I got over there. So you should be able to do at least that much here.
So as money gets shifted towards one industry versus another, is it kind of like a group think type thing where everyone says, oh, everyone's investing in digital health, and people start looking that way?
There's definitely a bit of that, because if you look at some of the reports that are out there, they show that diversity of who's writing the check is much broader now than it was 10 years ago, right? There's been a lot of money that's come into this that's been burned, right? The startup failure rate in healthcare, I'm sure, is comparable to any other segment. I haven't seen any cross-segment comparisons, so I can't be sure of that, but there's a lot of money that just goes down the toilet with startups, right? It's 9 out of 10, I think, was the last statistic I saw. Companies fail in healthcare. Major pivots occur, get bought up, acqui-hires, et cetera. So it's not for the faint of heart. I think there's just, it's interesting to watch it. Investors who get burned just will go into another segment because they're not stuck with healthcare, and that's okay, because we don't need more capital in healthcare. There's definitely no lack of capital at this point. It's actually, it's quite the reverse with the people I talk to on the money side. They have way too many options to look at and consider. Way too much risk, and they're becoming much smarter investors. It's fascinating over the last decade, Ryan, because in the beginning it was like, oh, that's a great idea. I'll give you $1 million right now. And now it's like, oh, well, where have you done your pilots? What were the results? I need a reference customer. Like, show me implementation. Show me like metrics. First, they're de-risking their investments and asking a lot more savvy questions, which is interesting because the idea is you have to risk capital, and there's not every company's going to have all those answers. Somebody has to write the first check and take the initial risk.
Does having so many options, does that simply stem from it's such an inefficient system or process at a macro level now?
Sorry.
Does having so many options to choose from as a VC or an investor, does that stem from just there's so many opportunities to innovate?
Yeah, that's a piece of it. It hasn't been a very, what I'd call a highly competitive marketplace. So it'd be a handful of companies going after each problem type that's out there. And I think you're just seeing that's changing because there's just so much more noise in this space. And people who are doing tech companies and have had one or two successful things they've done that's not healthcare saying, hey, what else can I do next? Hey, here they just spent $8 billion last quarter on healthcare investing. Maybe I can go do something in that space, or something happened to someone who I know or a family member. So maybe I can take my last company's exit capital and bring that into healthcare. So you're seeing a lot of different avenues to get into healthcare, but there's just so much capital and so much noise around digital health. And, you know, if you think about it, historically, healthcare has been recession-proof. Yeah. There's a lot of people thinking that, you know, healthcare has also been bubble-proof, that you can literally just keep dumping money into it because of the size and nature of it, that you're not going to get saturated soon. But that, I think, it's creating a huge number. I literally spoke with someone who runs a major fund at one of the big hospital systems. Mm-hmm. He said, I couldn't take almost any of the meetings that I came in. A small percentage of what was requested while I was here.
Huh.
He said he had hundreds of requests for meetings just in these 4 days, which is way up from the last time.
Yeah, sure. So what you talked about corporate partnerships or corporate investors. That's clearly been on the rise, and it seems like, and actually the presentation I just came from, that it was Novo talking about how they just simply recognized they didn't have the expertise that they needed. Is that the most common entry point for some of the corporate larger conglomerates?
In terms of bringing in outside talent, you mean?
Partnering with startups, or I guess finding a way to, I think a lot of healthcare organizations don't have either the culture or the technical skills, fill in the blank with, there's a lot of considerations I think you need to be able to effectively innovate in digital. Yeah. And do you find it's common for the corporations that are starting to invest in some of these, that it's coming from a place of a gap? Yeah.
I think just like anyone who has capital to deploy is going to basically have a portfolio they have to balance, right? And they're only going to take so many really high-risk bets if they're balancing their portfolio versus a few bets that are a little more certain and have a better chance of success. And frankly, if they're also an organization that can enable that success by incorporating into their own system or sharing with other organizations that are not competitive, they're doing a lot. They're getting a lot smarter around how they invest. So there's only so many early stage investments they can make, and frankly some of these funds don't do any early stage. They'll only get involved when it's proven, and they're really looking to not design and development, but really they just want to get to growth. This is proven, I just want to be part of the growth side of it, and they just don't want to deploy any capital. So you have to it really just varies tremendously by who's investing. And of course there are some who are all about the early stage design development, and they know the hit rates are much lower there.
Yeah. Do you think the large companies, it seems like, from my perspective, the answer is probably yes, that they recognize digital technology and the transformation it can have, whether that's analytics or new types of offering for patients. They recognize the potential, right?
Oh, yeah, for sure. Okay. I think it's the lack of doubt about the impact of adoption of technology and analytics on the business of healthcare delivery and health and well-being. We're kind of past that.
Okay.
There was a lot of doubt a decade ago around, people would think, yeah, it's going to matter, but how much? Is it worth it? Why should I do this now? I'm making a lot of money the way it is. Change is hard. Yeah. And typically people who are the first ones to go make change don't do that well because they're learning, they're blazing trails, and trailblazers tend to not always come back.
Yeah, right.
Blazing that trail.
High risk, high reward.
But there is, I think a lot of it, frankly, is just that what's the culture and attitude at the organization we're talking about. And as you know, there's a handful of early adopters of technology, and they're driving it. And they're very sophisticated, very, very sure about what they're doing, and they enable success. It's not just writing checks; they're enabling success on the back end, which is the best capital to get if you're a startup. Right? It's not just not all dollars are equal. It's the bottom line. Getting money from a person who doesn't know anything about healthcare and just going to say, hey, and bother you every month or so to say, hey, where's my money? How are you doing? And they have no way to actually enable your success is nowhere near as valuable, right? I would walk away from that all the time, right? I would much rather say, okay, let's talk about a strategic conversation around, beyond the capital, what else can you do to help us be successful? Because you want us to succeed. You're writing us a check.
Yep. And especially when there's a huge amount of dollars available, hopefully you're coming from a position of strength where you can find that best partnership. It's
very interesting. It's a huge amount of dollars available and a huge amount of companies available. So now it's just getting through the screening process is really challenging. That being said, the dollars have to be deployed somewhere. So a good idea, you should have more than one term sheet that'll come their way, and they'll have to pick from whoever. And on the other hand, it's how do you get to that enviable position? It doesn't happen that often because there are so many companies. Yep. So it's kind of chicken and egg.
Yep. So looking towards the future, I guess, what do you see coming, or what do you see happening now that's changing for the future? Is there anything that jumps out?
Yeah, I think it's just a maturation of the marketplace on every side. I'm seeing much more savvy investment capital. I'm seeing much more savvy payers and providers understanding the role and the need to adopt emerging technology and analytics across the board. in every aspect for their employees, for their patients, for their members, for their employees.
Yeah.
Everybody gets it. So it's really interesting to watch the level of the conversation. It's rising significantly. That being said, it's also being acknowledged and understood the complexity of implementation, scaling things in a sustainable fashion, and having an ability to measure impact. And like, what are we actually trying to impact? Is it capital? Is it human health and well-being? Is it the well-being of my employees, my doctors and nurses and other staff? Like, if all three of those things don't do well, we failed because it won't be sustainable. If you burn out the providers, then who provides the care? If the consumers don't like what's happening, then we're not going to get healthy, right? And if you're not getting a reasonable value proposition for whoever's paying for it, they won't write the checks. So it's really an interesting balance. But what I'm seeing is a tremendous amount of focus more and more at the community level and in a much more sophisticated conversation after having, everybody's been doing this for over a decade now, since digital health became a thing, right?
Sure.
And the conversations are becoming much more sophisticated because we keep scratching the surface. It's I guess a better analogy is an onion. There's just another layer of complexity. I was like, we hadn't even thought of that one. And I'm also, it's great to see much more collaboration across stakeholder types than you've seen in the past. And I'm also seeing some really interesting, dark horses coming in from outside, bringing their expertise to the table.
Yeah, or out of the box thinking. Yeah.
Oh yeah, for sure. I mean, a company like Amazon who's excellent at logistics management. Healthcare is one big logistics problem.
Yes.
Right people, right time, right place. How do you make all that happen? Walmart with the massive footprint. Healthcare is still a lot of human face-to-face engagement. How can they make a difference with what they just launched with their health stores?
Yeah. So do you think if you look out in the future, if you look at other markets or other sectors, it seems like they've produced clear winners of who's gotten this digital technology right. Do you think the same thing will play out in healthcare at all, and that winners and losers will clearly be distinguished in the future? Yeah,
for sure. Things will shake out. I think right now we're still clearly still storming. It's a long storming process because healthcare is so large and so complex. $3 trillion industry is not like we're changing a $100 billion industry. It's a orders of magnitude difference in complexity. What is it? The 5th largest employer in the country, healthcare. So that's also part of the challenge, right? How do we, reduce the cost, but not lower employment at the national level by reducing the cost by getting rid of people? It's still mostly human capital intensive industry. So I think there's going to be a tremendous opportunity in the future for improvement across the board of health and well-being while bringing value to the table. So I'm very optimistic around where this is all going to go. It's going to be an incredibly bumpy ride, and it's not going to happen at a national level. It's going to happen at a much more geographic level as cities and states adopt the policies and the culture of health and well-being at a local level that enables the local providers and payers and consumers to actually participate in a way that's aligned. Because there's this massive temporal misalignment of incentives across these stakeholder types, right? Where does the dollar value accrue for the well-being of the consumer? Is it with the payer, the provider, the employer, the government? Where does it sit? And that needs to be rectified. And it's great that we have the technology and analytics in place, increasingly coming into place, like capturing social determinants of health data, right? Capturing clinical data, merging all that, capturing your genome and biome. All these different data points are coming and converging. And we're not getting a much better picture of what health and well-being means. And the stakeholders can actually see that now.
Yep. So you mentioned you're an optimist. So I assume, and especially based on what you just said, you think it does play out and ultimately get to a better place. And I assume you define better place by the application to patients and humans, right?
Yes. So I think I'm a pragmatic optimist. I think the pragmatic part kicks in with it's going to be a bumpy road from here to there. The marketplace will shake out. You'll have some organizations who are not going to make it work, and that's okay. That happens in every industry. You have there was hundreds and hundreds of car companies in the beginning, and now there's a handful that run the marketplace. That's probably going to happen in healthcare. It may settle on a much larger number because it is a much bigger industry than most other industries. So you probably have less payers, less providers, less solution providers. but you don't necessarily need a huge number of them to be successful, but it'll probably be larger than other industries. It's going to be a bumpy road. It's because it's not going to be something where we can just dictate what happens nationally. It's going to happen locally.
Sure.
And so it fits and starts.
Well, we covered so much today. Bounced around. Is there anything we maybe missed or anything top of mind that jumps out?
Yeah. For me, it's just going back to one of the things we talked about, which people who are in healthcare and well-being need to be in it for healthcare and well-being. We're seeing a lot of organizations come into this who are just focusing on raising capital, and that's truly a problem. And big, unicorns and exits and ROIs that are all financially focused. I would challenge everybody to think long and hard if you're in the healthcare industry, that you're actually in it for healthcare.
Sure.
Not just for the financial potential. That will come. So values-driven value is how I always think about it. So what are the values that you want to bring to the marketplace? And if you do well from a values perspective, the valuations and value of a company will come when it comes.
Work itself out. Well, great. Well, thanks so much for the time. I'm ending on the same question for all the folks I'm talking with. So what would you say is either the most exciting part about being in digital health, or what do you most look forward to in the future?
It's the best time to be in healthcare. I mean, the amount of opportunity to transform what it means to be human in terms of quality of health span, the technology that I see coming are amazing in terms of the impact on human health and well-being. I think it goes back to less that and much more on how do we address the business model and policy side so we can enable our technology and analytic capabilities that we're building to actually become sustainable and scalable in a reasonable time frame.
Sure. Well, I think that's a great note to end on. I know you do have consulting and advising services. Is there any good place you'd want listeners to get in touch with you if they were interested in working more or partnering?
Oh, sure. Well, best place to find me is on LinkedIn, actually.
Okay.
Paulo J. Machado on LinkedIn.
All right. Well, thanks so much for the time, and best of luck with the rest of the conference.
Thanks, Brian.
All right.
Taking the time.
Bye.